Radiology in a minute. I'm Matheus Soldatelli. I'm a pediatric neuroradiology fellow at the Hospital for Sick Children, Toronto, Canada. Today, I will present a summary of the paper entitled MRI Visible Perivascular Space in the Neonatal Brain, published in Radiology in April 2023. The purpose of this study was to perform a visual and volumetric evaluation of perivascular spaces, PVS, that are visible at MRI in neonates, and to evaluate potential associations with maturation, sex, and preterm birth. It was a retrospective study using brain MRIs of healthy neonates from Developing Human Connectome Project. Included only patients with MRI acquired after term equivalent age. A final number of participants was 244, and the PVS were graded in the basal ganglia and cerebral white matter. T2 weighted images were used to grade the PVS, ranging from grade 0 to grade 4, where grade 0 means no PVS. PVS at the level of and below the anterior commissure were excluded. Automated volumetric measurements of the PVS were acquired in the basal ganglia. Also, the basal ganglia PVS fraction was calculated by dividing the PVS volume by the deep gray matter volume. Results showed no difference between the groups regarding sex, punctate white matter lesions, or postmenstrual age at MRI. 63% of the neonates showed PVS in the basal ganglia, and only 7% showed PVS in the white matter. Regarding PVS in the basal ganglia, all the participants showed grade 0 or grade 1. The basal ganglia PVS differ from term neonates from preterm neonates. There was a negative relationship between the basal ganglia PVS fraction and the postmenstrual age at imaging, even after controlling for gestational age. There was a positive relationship between gestational age and birth and basal ganglia PVS volume. Preterm neonates born at 26 weeks underwent MRI at postmenstrual age of 42 weeks, and a term neonate born at 39 weeks underwent MRI at the postmenstrual age of 39 weeks, which is shown in this representative image. The basal ganglia PVS grade is lower, and the basal ganglia PVS volume is smaller in the preterm neonate. In conclusion, MRI visible PVS in the neonatal brain were associated with maturation and preterm birth, but not with sex. Most neonates showed PVS in the basal ganglia, but not in the white matter. The fraction of PVS in the basal ganglia decreased with maturation, and their volume was smaller in preterm neonates. Further studies are needed to evaluate potential associations between PVS and pathologic findings.